Welcome to Unit 2 of this STI Awareness and Prevention module. In this unit, we will look at strategies for detecting and managing STIs. By the end of this unit, you will be able to explain how clinical services can be used to reduce the burden of STIs. Most of the serious health problems caused by STIs are preventable. Communities with good access to effective prevention and treatment services have lower rates of STIs and their complications than communities where services are poor, disrupted, or not used by people at risk. Therefore, clinical services have a key role in reducing the burden of STIs. However, reducing the burden of STIs requires more than good clinical management of individual patients. STIs are transmitted in the community, and limiting interventions to clinic settings overlooks much of the problem. Let's look at some barriers to controlling STIs. First, poverty and labor migration separate families and lead to risky sexual behavior. Low status of women limits economic options and also leads to risky sexual behavior. For example, women may exchange sex for money or other forms of support. Low status also means little control over decisions and less ability to negotiate with partners. In some communities, poor healthcare services often have little to offer for prevention and care of STIs and RTIs. Some people do not have easy access to healthcare facilities, or people do not use healthcare facilities available, often due to stigma or fear of discrimination. So now that we have identified some barriers to controlling STIs, let's look at potential solutions. To address poverty and labor migration, economic and social policies that reduce family separation may also reduce STI risk and vulnerability. Creating migrant health and workplace health programs can strengthen STI prevention. Educational and employment opportunities for girls reduce the economic pull of sex work. Empowering women can reduce STI risk. Improved healthcare services can mean better STI prevention and care. Reducing barriers such as cost, distance, limited clinic hours, and long waiting times means better access to care. And better awareness of STI, RTI symptoms and complications, and promotion of improved and non-judgmental services can help convince more people to use healthcare services. However, challenges to providing effective STI services to the people who need them can extend further than the availability of healthcare, and there are a number of common reasons why STIs are not detected and cured. Firstly, not all people with an STI are symptomatic. Many do not show any symptoms. Even if they do have symptoms, many people will not seek health care. Of those who do seek care, some will not be correctly diagnosed. Of those diagnosed, some will not be given correct treatment. Of those treated, some will not complete the treatment. This limits the number of people with STIs who are actually cured. The good news is that many of these challenges can be addressed by making the most of opportunities to promote prevention, improve health-seeking behavior, and detect and manage existing infections. To improve healthcare outcomes, the first step is to target the community to encourage use of available services. Healthcare providers should raise awareness in the community about STIs and how they can be prevented, especially among populations who may be at high risk. Promote screening and early use of clinic services to cure STIs and prevent complications. Teach people how to recognize symptoms and when to seek care. Promote safer sexual practices, including correct and consistent condom use. When people seek care, it's important that healthcare providers detect infections that are not obvious. To do this, ask about STI symptoms when patients attend for antenatal care, family planning, or other reasons. Look for signs of infection when performing examinations. Screen for asymptomatic infection with STI laboratory testing where possible. Prevent iatrogenic infection by following universal precautions, using aseptic technique, and ruling out or treating cervical infection before performing transcervical procedures. Manage symptomatic STI effectively. Follow STI case management guidelines, including the syndromic approach and laboratory diagnosis. Counsel patients on staying uninfected after treatment. Encourage them to comply with treatment, assist with partner notification and treatment, and reinforce prevention. Follow good prescribing practice and counsel patients to minimize risk of developing antimicrobial resistance. STIs should never be seen as an optional component of reproductive health services. There is an opportunity to reach many women whose only contact with the healthcare system is reproductive health services. Most of these women are sexually active. Many are at risk of infection, and some have an existing infection. A combined strategy of effective community interventions and improved clinical services can have a large impact on STIs and their complications. Better clinical services increase the number of people who are cured. More effective prevention in the community, especially when it reaches those at highest risk, can reduce the overall STI problem. The combination of strategies benefits everyone. Sexual and reproductive health services have an important role to play in detecting asymptomatic STIs. Since many women attend reproductive health clinics for family planning, antenatal services, and postnatal care, there is an opportunity to identify women with an STI who would benefit from treatment. Sexual and reproductive health services should also reach out to men wherever possible. While men are more likely to have symptoms than women, asymptomatic STIs are also possible. More commonly, men may ignore symptoms if they are not severe. Healthcare providers can raise awareness about symptoms and encourage men to get checked if they have symptoms. As we have discussed, some people with an STI have symptoms and seek treatment, while others do not. Promoting symptom recognition and early use of healthcare services is an important way of reducing the burden of STIs. Many women and men with an STI do not have symptoms, however, or have minimal symptoms and do not realize that anything is wrong. They may visit a clinic for other reasons or not at all. Yet, identifying and treating such patients prevents the development of complications for the individual patient and helps reduce community transmission. In women, silent, asymptomatic infections can be more serious than symptomatic ones. Syphilis, gonorrhea, and chlamydia have serious consequences, yet are often asymptomatic. Even serious STI complications, such as pelvic inflammatory disease, often have mild or no symptoms. Therefore, for clinical services to reduce the burden of STIs, healthcare providers should know how to identify people with STI signs, symptoms, or risk. Pregnant women should undergo screening for syphilis. This is an effective strategy for preventing congenital syphilis and is part of the essential package of antenatal care. Women with previous spontaneous abortion, stillbirth, or preterm labor should be screened for other STIs, including syphilis, gonorrhea, and chlamydial infection, and for presence of trichomoniasis and bacterial vaginosis. Every opportunity should be taken to detect cervical infections by careful speculum examination and, when possible, laboratory tests. You've now completed Unit 2, Detecting and Managing STIs. We will now look at the topics we've covered in context using 2 case studies.